Hello, everyone. We're putting our very own CEO in the hot seat today. 6 questions, 6 wings, 15 minutes. Also, a very special thank you to our episode sponsor, Heavenly Buffaloes, for providing us with these delicious flavors. All right, welcome to It's Giving Health Hot Seat Edition. I am your host, Donnae Ward. Today, I am joined with Scot McCray, CEO of Advanced Community Health. Want to introduce yourself?
Well, what's going on, Donnae? And It's Giving Health. I'm just locked into the wing. Scot McCray, CEO, and Mr. Antacid of Advanced Community Health. Looking forward to today's conversation and tasting these wings. Shout out to the sponsor as well.
Okay, all right.
Providing the delicious fare here.
Yes. All right, so let's dive right in. Like I said, today we have 6 flavors and 6 spicy questions. Let's start you off easy with honey barbecue, okay?
Okay.
True or false? It's the honey barbecue one here. True or false? Most people on Medicaid could just get a job and afford private insurance instead.
No.
What'd you think about that?
So, that's false. Medicaid is one of the truest pieces of safety net legislation this country has ever adopted, specifically for individuals of certain incomes. It's income-based, so between 19 and 64 years of age. And a lot of these folks have particular social drivers or situations in life that will prohibit them at the time from actually being a part of private insurance or even paying out of pocket. The monthly and annual incomes for Medicaid is extremely low. Insurance premiums, especially in the marketplace or elsewhere, are extremely high. So Medicaid provides ultimate coverage across all primary care, specialty care, et cetera, even pharmacy options for people that need it most. I mean, you think about hourly employees that make a certain wage, working class people. We need to keep people healthy and well, and that's why Medicaid's there.
Okay, thank you. Fair enough. Next, we have something with a little more twang.
Do I need to finish this one first?
If you want to.
I'll eat while you
But
talk.
look,
Go ahead.
okay, well, go ahead. All right, this is Carolina honey mustard. This is our second one. So what about the biggest myth about Medicaid that you would just want to disappear? What is like a myth that you just would wish people would just stop?
Let me take a bite first.
Okay, go ahead.
So the number one myth, where are my manners? Right out the window. The number one myth is that Medicaid is for poor people and black and brown people only. And I think that's been exacerbated over the last few years. Unfortunately, with the political climate, it's been weaponized. And it's just not true. Medicaid, again, is an income-based program that's necessary for safety net care, period.
Period. Good. Okay. I like that one.
These are really good.
I had a little sweetness to it. All right. So let's start turning up the heat with spicy barbecue. Okay. 42% of our patients have Medicaid. What do these Medicaid cuts mean for our patients? Spicy barbecue. Spicy question. There's a little spice. There's a little spice in there. Get on the back end. You know what I mean?
Not too bad. Oh, wow.
Yeah.
Okay. Yeah. Mild. So the Medicaid cuts for our patients can be extremely detrimental. 40+% of our patients, as you said, access to necessary care, comprehensive care, pharmacy, behavioral health, pediatrics, family medicine, care management, et cetera. And you start thinking about what happens if these people fall out of that income category. Where do they go? They end up in the emergency department. 25% of all ED visits are related to primary care diagnosis, things that shouldn't be there. The cost of a visit for us is greatly less. So you're talking about a $100 visit on average compared to a $1,300 visit for a sprained ankle or a rash or an earache, right, or a common cold in the emergency department. So again, weaponizing and villainizing Medicaid to a specific demographic is completely detrimental to cost savings for the system and access for people that need it the most.
Okay. So now it's really about to get hot in here. All right, with Buffalo Media. If you could tell state legislators one thing about Medicaid that they clearly don't understand, what would it be?
Okay.
Okay. I love the silence. You're trying to like...
Get myself together.
Yeah.
It's not the question, it's the wing. So, in short, I would really convey to our legislative body, for the most part, they get it. But again, I think it's depending what day of the week it is, what side of the aisle you're on, is that Medicaid is the best solution for critical access for working class people, period. I believe the work that we do as a federally qualified health center, community health center at Advance, across 2 counties, Franklin and Wake, we provide the best access, quality, and the best price at the pump to actually see better outcomes for Medicaid patients, period. So they really need to lean on the federal designation that's here in the state, us, including another 42 community health centers to deliver that care, to be on the front lines for patients that need us the most. Again, affordability and access is key, and that's what we provide. And I think that we're missing the mark a little bit by pushing Medicaid and allowing other entities, I will say bigger health systems, to taint and to actually pull away from the Medicaid pot that really should be at a community-based level for primary care providers, and quite frankly, not at a hospital-based level, because that's when it really gets skewed.
Okay, you heard that? Affordability and access are key. Okay. I hope these questions aren't too hot for you. All right. Anyway, let's see. Okay, next up is Buffalo Hot, okay? If someone says Medicaid is just welfare, how do you respond without losing your cool? You good? You need some of that milk?
I'm good. I'm good right now. Medicaid is well beyond welfare. I think, again, it gets lumped into that pot of what's for povertized people, impoverished communities, et cetera. You think about urbanized regions, I will tell you there's just as many people that are on Medicaid and utilize Medicaid that are in rural areas where there's many more trees and there's grass and farms versus where I grew up in the city, up in New Jersey, that need Medicaid as well. And it's not welfare.
Right.
It's not welfare. Welfare, much like Medicaid, is part of that social service push 60 years ago that provided a bridge, if you will, right? Some gaps where people needed it the most. This is starting to heat up a little bit. But I think the welfare case goes to who's getting it and the image that we put on welfare and Medicaid for years. So it is not welfare at all. 2 totally different types of programs, but still designed systematically the same way to provide a bridge for people. Unfortunately, there are some dynamics of Medicaid or the Medicaid population within that age group, depending on disabilities, where people stay on Medicaid for a long time, right? People that can't work, people that have been injured, right? People that have developmental disabilities, et cetera. So I think there's carve-outs for all of that, but the imagery that we put really should be skewed to what's most important for folks, how we're utilizing Medicaid, and how we continue to uphold the banner that Medicaid was built on, and how do we maximize it, and actually push it out to the people that need it the most.
Love it. Well said. Okay. All right. You you ate yours.
That wasn't too bad.
Yeah.
Go ahead.
That one too. Okay. Other one. I think you skipped one.
No, we just
You just.
we're good.
That's your 5th wing. We're gonna go to the 6th wing now.
You sure?
Yep.
Hold on.
All right. Go ahead and take.
Go
So
ahead.
that one should have a little bit more of a kick.
It does.
Okay. So
ahead.
now for our last
I'll catch
question.
up a little bit.
Okay. Got to catch up. For our last question, coming in hot is this signature flavor, Bernie's ass off. Bernie's ass off. Finish this sentence. If you can handle the heat, if I ran the country for one day, the first thing I changed about Medicaid is blank. You ready for the signature? Okay. Go ahead.
Let's do it. So, if I ran the country for one day, the first thing I'd change about Medicaid was ensuring that there would be a continuance of funding for Medicaid, right? Etched in stone,
No cuts.
with the guardrails and the parameters around what it is for, and ensuring that it never became political football. I think when you're dealing with Safety net, you're dealing about programs that were created to help people survive, to get from point A to point B, and to provide critical services.
Yeah.
It should never be used as ammunition. I would also build in provisions that Medicaid could be fueled more deeply at the community level for private practice practitioners, practices, really push it away from health systems, right? In the sense that they use it as a feeder for their specialties, and ensuring that community health centers, again, in their comprehensive nature, would have the ability to build upon that reimbursement and prove out better outcomes for individuals that have chronic diseases. One of the things you find is that community health centers like Advance statistically have proven better outcomes for those individuals with diabetes, hypertension, comorbid conditions, high-risk folks, people that go to the ED, frequent themselves in and out of inpatient settings more. That's where we need to improve reimbursement.
Right.
That's where we need to attach more health education, right? More opportunities for Medicaid and Medicaid-like programs through health education, through community-based programs to actually deal with those social drivers that are proving out to be the biggest barriers for people not being able to get well and healthy and stay that way.
Agreed. Those social determinants of health. Okay.
This one was hot.
That one had a
This
little.
one was hot.
Yeah.
Okay.
So before we go, giveaway time. Another special thank you from this episode sponsor, Heavenly Buffaloes. At Heavenly Buffaloes, they're passionate about serving up bold flavors, quality ingredients, and the best dang wings around. With 5 locations across the triangle, you'll come hungry and leave heavenly. If you are the lucky winner, you'll get a gift card with your win. Okay? As a reminder, we'll be raffling off exciting prizes every episode. Stay tuned to your email and our social media for your chance to enter. Thank you so much for doing this. You were such a great sport.
Thanks
You
for
good?
having me,
Your
Donnae.
eyes watering
Thanks so
a
much.
little bit.
It was a little,
I think his head's sweating.
Just a little bit.
And y'all, don't worry. We're going to clean these chicken bones. We were raised right, so we're going to make sure we finish the rest of these, okay?
Most definitely.
And for everyone watching, if you enjoyed this, hit the subscribe button, drop a comment with questions you want to ask us about our next guest, and check out our full audio episodes where we dive deep into all things about health. You can catch us every first Wednesday for a new episode of It's Giving Health, and every third Wednesday for our Hot Seat edition. You can find us on Apple Podcasts, Spotify, YouTube, Podbean. Subscribe to our Advanced Community Health and Advanced CHC to stay up to date on the latest episodes.
That's the longest outro ever. Come on.
I know. I'm Donnae Ward.
I'm Scot McCray, CEO with Advanced Community Health.
And It's Giving Health.